My name is Emma and my student number is 155145204. I'm in section KAA, course code PNE 203. Here's my Seneca ID badge and a 360 of the room for my head to toe assessment. I would begin by sanitizing the bell of my stethoscope with the bell and the diaphragm of my stethoscope with the alcohol prep pad. And I would perform hand hygiene. And I would don on clean gloves. Okay? Now I can begin. Hi, my name is Emma and I'll be your student nurse for today. Can I get your name and date of birth?
William Overton, 1931.
Okay, perfect. I have to do a head to toe assessment on you. Is that okay?
Yes.
I'm going to just close the curtains for privacy. Do you have any pain or discomfort?
No.
And do you need to use the bathroom?
No.
Okay, perfect. So we're going to start off with a general survey of my patient. Overall, we can see his skin color is appropriate for his ethnicity, and we can see that he appears to be appropriate for his developmental age. Now we're moving on to body structure. William, could you stand up for me and sit back down? William is the appropriate height, as well as symmetrical. William is nourished and has no overall physical deformities. Now we're looking at William's behavior. William is in a calm and cooperative mood. He is dressed appropriately for the occasion. William is also able to maintain appropriate eye contact, and his hygiene is overall well intact and well kept. Okay? William, I have to ask you 3 questions. Can you tell me the month, your name, and where you are?
November, William, in the hospital.
William is alert and awake to place, time, and self. Okay? Now we're looking at his work of breathing. William appears to be in no signs of respiratory distress, as he is breathing effortlessly and unlabored. Okay, William, I'm going to begin by doing an examination of your head. I'm just going to inspect. William's head is overall symmetrical. I see no signs of edema, no scarrings or lesions or any masses. Okay? Now we're going to be moving on to testing William's cranial facial nerve number 7. William, can you raise your eyebrows for me? Perfect. Can you close your eyes? I'm going to try and open. Don't let me open, okay? Perfect. William, can you frown? Can you smile for me? Can you show your teeth for me? And can you puff out your cheeks? Thank you. Williams was able to perform all of these tasks symmetrically, meaning that his cranial facial nerve number 7 is intact. Next, we're going to be assessing William's eyes. So we're looking at William's eyebrows. We see that they're symmetrical. We see William's eyes are round equally, and we see an equal distribution of eyelashes on both sides. I see no signs of lid lag, and now we're going to take a quick look at his sclera and his conjunctiva. The sclera is a nice white color. William, I'm going to pull down and look at your conjunctiva. Okay. William's conjunctiva is a nice light pink color with a few signs of, with a few red blood vessels showing. We see no crusting, no discharge within the eyes. Okay. Now we're going to be assessing his cranial nerve number 3 using PERLA. His cranial nerve number 3 is his ocular motor nerve. William, I'm going to look at your pupillary size. It is 4 millimeters, symmetrically on both sides. We're looking at the shape and the size. They were round, they were symmetrical. Now we're going to be testing his direct and consensual light test. So William, I'm going to be shining the light. Look straight ahead for me. Okay, other side. William's eyes were able to consensually constrict and dilate in response to light. Okay, now we're looking at William's ability to accommodate. William, could you follow the pen? My patient's eyes were able to constrict and converge, meaning they were able to accommodate and that their cranial nerve number 3 ocular motor is intact. Okay, now we're moving on to William's nose. Back to eyes. I saw no signs of ptosis or anisocoria. Okay, now we're looking at William's nose. William, we can see his nose is in the midline. We're going to be testing for patency now. William, can you push on a nostril and breathe in? And the other one. My patient's nose appears to be patent, midline, and there are no signs of any discharge or nasal flaring. Okay, we're taking a look at William's ears. William, we'll look at your other ear. My patient's ears have little to no signs of cerumen. They are symmetrical and they are intact with no discharge. Okay? Now we're looking at William's lips. We can see William's lips are a nice pink color and they are moist with no lesions present and no signs of dehydration. Now we're going to take a look at, we're going to be testing William's cranial nerve number 9 and 10, his glossopharyngeal and his vagus nerve. William, can you open your mouth for me and say ah? Perfect. His soft palate and his uvula were able to rise, meaning that their cranial nerves are intact. Cranial nerve number 9 and 10 are intact. Now we're going to test William's hypoglossal cranial nerve number 12. William, stick out your tongue for me. To me and to that side. Okay, perfect. And back in your mouth. And can you say light, tight, dynamite?
Light, tight, dynamite.
Perfect. William was able to follow commands and say these words without any tremors present, meaning that his cranial nerve number 11 is intact. Sorry, number 12 is intact. Okay? Now, William, we're going to be moving on to your neck. Taking a look at William's neck, I see symmetry, I see no scarring, no lesions or abnormal pulsations, and I see the skin color is consistent through the body. Okay? Now I'm going to palpate. William, please tell me if there's any pain or tenderness.
None.
Okay, perfect. My patient has no pain or tenderness. We want to see that the trachea is midline, so you're going to go out and up one. Perfect, the trachea is midline, and I'm going to feel for thyroid enlargement. There's no obvious thyroid enlargement. The patient feels no pain, tenderness, no tracheal deviation, and I felt for no abnormal masses. Okay? William, we're now going to feel your carotid pulses. Perfect, other side. Perfect. William's pulse is at a +2 strength with a rapid upstroke and a slower downstroke with regular rhythm present. They are equal bilaterally. Okay? Now we're going to be testing his spinal accessory nerve. This is his cranial nerve number 11. Okay? William, look towards me. Look over there. And now shrug your shoulders, William. I'm going to apply resistance, okay? Don't let me push. Perfect. Now look towards me again. I'm going to push. Perfect. Other side. Look towards me. I'm going to push. Perfect. My patient was able to do so with full resistance present, meaning that his cranial nerve number 11, spinal accessory nerve, is intact. Okay? Now, William, we're going to be moving on to your arms and legs. If you could unzip, we're looking at your peripheral vascular. I'll take that for you, William. Taking a look at my patient's arms, we want to see that they are symmetrical. I see the symmetry, I see equal hair distribution, and even his skin color is consistent throughout his body. I see no signs of joint inflammation or edema or any masses or scarring or lesions present. I'm now going to begin to palpate. William, please tell me if you feel any pain or tenderness.
None.
Okay, perfect. My patient, and now I'm going to feel for the temperature with the dorsal portion of my hands. My patient is warm to touch and is consistent throughout his body. I feel no edema or joint inflammation. My patient is appropriately moist, and I felt no masses or any lesions. Okay? Now we're going to be moving on to William's lower portion. Go back for me, William. Okay. Looking at my patient, in a clinical setting, I would have his pants removed and drape him appropriately. Okay? I'm going to begin by inspection. I see symmetry, the legs are symmetrical on both sides. I see even hair distribution and as well skin color. I see no signs of joint inflammation or any edema present. And I also see no scarring, okay? I'm now going to palpate William. Please tell me if you feel pain or tenderness.
None.
Okay? My patient's lower extremities had no signs of pain or tenderness. There was no masses present. I felt for no edema. I'm going to feel that the skin is warm to touch with the dorsal portion. My patient's skin is warm to touch and appropriately moist. Okay? Now, William, I'm going to be moving on to your posterior thorax. Oh, sorry. I have to feel my patient's radial pulses first. I'm going to feel your radial pulse. My patient's radial pulse is equal bilaterally with a +2 strength and regular rhythm. And now, William, can you squeeze my fingers? This is the grip test. William was able to equally bilaterally squeeze my hands with firm grip and strength. Okay? Now I'm going to move on to your posterior thorax. If you could turn to the back for me. Okay, William, I'm going to move in here. Just come a little closer. Okay. I'm going to start with inspection. Upon inspection, I note that my patient's posterior thorax is symmetrical. His skin color is equal throughout his body. I see that there's no skeletal deformities. I see no scarring present or any lesions present. Now I'm going to palpate. Let me know if you feel any pain or tenderness.
None.
Okay. My patient I felt no pain or tenderness. I feel the skin is warm to touch. There's no lesion, no pain, no tenderness, no appropriate warmth, appropriate moisture, and no masses were present, and no abnormal pulsations. Okay? Now I'm going to check for symmetrical lung expansion as part of my palpation. So William, I'm just gonna place my hands. I'm gonna pinch a little. I'm gonna get you to take a big deep breath in and out. Ready? My patient's symmetrical lung expansion is present as my fingers were able to move together and apart symmetrically. Okay? Now I'm going to begin with oscillating. William, every time you feel my stethoscope touch your back, please take a big deep breath in and out. Perfect. Bronchovesticular and vestibular lung sounds were heard, as well as no signs of any fluid, no crackling or wheezing was present within the lungs. Okay, William? I'm going to take a look at your anterior thorax. If you could turn to the front for me, please. I'm going to be counting your respiration rate. In a typical clinical setting, I would not tell my patient I'm counting the respiration rate. Okay, but now we're going to do so, so William, just relax. I would do so for 30 seconds. My patient has a respiration rate of 16 breaths per minute, as well as they were breathing quiet. The breathing rate was quiet, regular, effortless, and unlabored. Okay? Now we're going to be moving on to the cardiovascular portion. William, if you could get up and come onto the table for me. I would drape my patient accordingly. Okay? We are going to be auscultating William's apical pulse. His apical pulse is also located at the apex of the heart as well as the mitral valve. Its location is the mitral valve as well. It is located on the left sternal border, mid-clavicular, 5 intercostal spaces down. We are going to begin to auscultate. I'm going to listen for 30 seconds. Okay? I heard regular S1 and S2 sounds. My patient had a apical pulse of 64 beats per minute. Rhythm was regular with +2 strength. And now I'm going to listen with the bell of my stethoscope as we want to see if we could hear any S3 or S4 sounds present. And the same landmarks, left sternal border, mid-clavicular, 5th intercostal space. No S3 and S4 sounds are present. Okay, that's great. Now we're going to move on to our abdominal assessment. So I'm going to drape only the abdomen showing. In a clinical setting, I would have a proper drape, the abdomen. Okay, we're going to begin inspection. Looking at the patient's abdomen, we want to make sure the umbilicus is midline. We want to make sure the skin color is consistent throughout the body. We want to make sure there's appropriate symmetry and that we see no pulsations occur. Okay? Now I'm going to begin by listening. We begin in the right lower quadrant, moving upwards in a clockwise direction. Okay? Okay, I heard active bowel sounds in my patient's abdomen. I heard 5 to 30 active bowel sounds per minute. If I did not hear any, I would begin to oscillate for 5 minutes. I heard signs of cascading and gurgling. Okay, now we're going to move on to palpations. I'm going to palpate in the right lower quadrant, moving upwards in a clockwise direction as well, using light palpations in a circular motion, okay? Okay, there were no signs of rigidity or guarding. Okay, that is all, William. The physician will be with you shortly.
Thank you.